A fifth lawsuit has been filed against a Lawrence mental health facility accused of holding patients against their will. A new Whiteland woman was a patient at Options Behavioral Health, and she says she had to clean up her roommate's feces because the hospital staff refused to do it. WRTV Investigates Kara Kenny joins us now with the latest developments.
Maria Reagan lives in New Whiteland and loves animals. But since she was a teenager, Maria struggled with anxiety and depression.
I've lost my parents when I was younger and my brother.
In September, Maria went to an emergency room after suffering a mental health episode. She was transported to Options Behavioral Health in Lawrence, one of 35 state-licensed mental health facilities.
So I was looking forward to going there and kind of, getting the help I needed.
But Maria says she didn't get help. According to a lawsuit filed November 19th against Options and its parent company, Acadia Healthcare, Maria was given coloring pages like these and broken crayons.
So I grabbed a piece of paper of a little puppy and I started coloring it.
Did you ever see a psychiatrist while you were there?
No, I did not. I did not see a psychiatrist at all.
I would imagine if you'd asked 10 people on the street, would you be seen by a psychiatrist if you agreed to go to a psychiatric facility? 10 out of 10 would say yes.
Maria's lawsuit alleges she witnessed Options staff deny medication to a patient. In a separate incident, Maria says staff gave her wipes to clean up after her roommate got sick and there was feces all around their room.
What was that like, having to clean up your roommate's feces?
I was scared because I didn't want to get sick. And I was scared and angry that nobody was doing anything. I was shocked. I felt like I was in the twilight zone. Like, where am I?
Indianapolis law firm Cohen and Millad has filed a total of 5 lawsuits, all alleging Options held patients against their will. In a statement on Acadia Healthcare's website, the company says, "To be clear, we patently reject claims that Acadia places profits over patients, including inferences that we systematically hold patients longer than is medically necessary for financial reasons." Acadia also points out their average length of stay at acute hospitals is 9.3 days, in line with national averages. WRTV Investigates asked Acadia specifically about the 2 most recently filed lawsuits against Options Behavioral Health. They declined an on-camera interview, but sent us this statement. While we cannot comment on active litigation, Options Behavioral Health takes the well-being and quality care of our patients seriously as we strive to provide assistance and recovery from mental health and addiction concerns. Maria thought she would end up at the facility for 72 hours, but it ended up being more than a week.
I told my family, I said I felt like I was in hell for 8 days.
She's filing a lawsuit in the hopes of helping others seeking mental health treatment.
It's a hard thing to do, but it has to start somewhere.
Kara Kenny, WRTV.
Acadia Healthcare also points out the decision to involuntarily commit a patient for psychiatric evaluation is typically initiated by emergency rooms, police, and other parties. You can read more from Acadia Healthcare in this story on the WRTV app and at WRTV.com.